Um, a latent bacteria for the TB virus can live inside of a person's body for a significant amount of time, even a lifetime, without ever causing any symptoms of illness or the person noticing that they even have the bacteria. So for a while, the body, or for a lifetime, the body is able to fight off the infection, and the patient would never know that they needed to be examined or tested for TB. So at this stage of the bacteria when the bacteria is latent, the only possible treatment is to help prevent tuberculosis from developing in the future. And that treatment can only begin if the patient knows that they need to be tested, receives a positive TB test, and is consistent with their treatments despite not feeling any symptoms. So this could be one of the big reasons why latent tuberculosis is harder to treat, since patients don't feel sick, they don't feel symptoms, and so they could very easily slack off on their treatment, on their pills, on their plan. They could realize that they don't need it to feel better because they don't feel sick. So then latent tuberculosis will develop into tuberculosis full if they are later given, have a compromised immune system, and so then they have to be treated. They will want to be treated if they have tuberculosis disease. They just don't feel the urgency if the disease is latent. So as far as the ethical problem, there's technically no crime that has been committed in this situation. Jail time is for people who have committed crimes that are illegal or against the law, and not following a doctor's orders is not illegal. And also, it's technically not illegal to not disclose to people that you are sick. So you don't have to tell people in your flight or in your community that you have TB, and you're exposing them to it whether they know you're sick or not. So I don't know that jail time is the solution or even an option in this situation. Is it ethical for that person? No. But is it illegal for that person? Not really, no. So I don't think jail time is the answer, the ethical answer. I don't think they could even be arrested. I think a doctor could prescribe like a stay in the psych ward or something along those lines, to where they have to keep them confined, restrained, until they're treated. But of course that is only if they're willing to do that as well.